Well, February is National Children's Dental Health Month, and joining us today is Dr. Alex Otto, board-certified pediatric dentist and the founder of Kids Tooth Team Pediatric Dentistry. Thanks for being with us.
Yeah, thank you so much for having me.
And I gotta say too, right now I've got a toothache the size of Texas in my mouth, so oral health, very important, right?
Yes, it's very important.
So let's talk about the kiddos. Talk about the importance of children's oral health.
Yes, children's oral health is so important. Kids have their baby teeth until they're about 12 or 13 years old, and so it's really important to take care of them at a very early age. Poor oral health has been linked to poor academic performance, worse nutrition. So it's really important to have good oral health so that kids can, focus and do well in school, so they can eat and get proper nutrition. And then it also helps with speech. Obviously, you use your teeth to talk and speak, so it affects all parts of their life and their body.
Talk about a little about Kids Tooth Outreach that you guys do.
Yeah, so Kids Tooth Team Outreach is our mobile dental program. It's a nonprofit organization that we founded. You guys probably know about St. David's Foundation. They're one of the largest dental nonprofits in the country. So back in 2021, they donated us one of their dental vans. St. David's is incredible, and they serve a lot of the kids in the Austin community, but we reach out to the surrounding areas. We go to Elgin, Dale, Lockhart, San Marcos, and really serve kids in Central Texas that need dental care. And so we have a huge van that you guys can see. It's got 2 dental operatories, and so we partner with local elementary schools and provide free dental care to kids in need.
Oh, wonderful! And it's stocked, like you said, with everything you need to take care of everything.
Yeah, it's like literally like a dental clinic on wheels. So it has everything that my private practice, like brick and mortar office, has. It has 2 full operatories, a panoramic X-ray machine, all the dental equipment and supplies. And so we can do exams and cleanings, but we can also do treatment that kids need. We can do extractions, crowns, fillings.
Wow, really?
Yeah. So really, just our goal is to be a dental home to these kids, and so to be able to go back to their schools every 6 months, make sure that they have access to a dentist and dental care.
Yeah, that's great. And also a lot of families rely on Medicaid for their health care, but some kids still go without taking care of their cavities. What happens if you don't treat a cavity at a young age and right away?
Yeah, that's you're totally right. About 50% of kids in Texas are on Medicaid. A lot of them do rely on Medicaid for their dental services. It's disheartening because some of the Medicaid carriers, specifically DentaQuest, is having new policies that are really going to limit access to care for kids that have Medicaid. And so it's concerning to us in the dental community that even if you have Medicaid, you might not be able to see a provider or get access to the care that kids need. And so that's really a big reason that we founded this nonprofit, is to be a safety net for these kids who, sometimes even if they have Medicaid, the parents can't take off school to go take the kid to the dentist or have access to that dental care. And so really we want these kids to be able to have access to the care that they need. Because it's really important. If kids have cavities at an early age, it can really, it can be, I don't want to be dramatic, but it can be life-threatening if kids have a really serious dental infection. Right. Almost every week I have a kid come into my private practice that has a facial swelling from cavities.
Oh, gosh.
We have to have them, be asleep, go under anesthesia to get their dental treatment taken care of because the decay is so extensive.
My goodness.
And a lot of parents don't know. The CDC actually named dental caries a silent epidemic because a lot of times, parents don't know that their child has a cavity until they go to the dentist, they get x-rays and regular checkups. So it's really important, as early as 6 months old, we like seeing kids. So, when they're, as soon as they get their first tooth, go see a pediatric dentist, get their teeth checked out and get them used to going to the dentist and getting dental care, because getting cavities at really early age can affect their, their overall health and well-being. And then it can also affect their permanent teeth that are coming in, which we want them to have and, be healthy forever.
Right. And real quick too, if mom and dad are having a hard time getting their kids to brush their teeth, what can they do?
Yes, I'm a mom myself. I have a 2-year-old at home. I have to headlock him every night and brush his teeth. Obviously making it fun. We really like parents brushing their kids' teeth until they're about 10 years old. So physically doing it for them. A 2 or 3-year-old can hold their toothbrush in the mouth, but they're just not going to get their teeth as well as you could as a parent.
Yeah.
So doing it together at home, brushing. If parents are brushing, the kid can brush next to them. Really helping them and make it fun. There's so many fun. Yeah, exactly. Fun toothbrushes, fun flavors that they can have. But there's just going to be kids who don't want to brush their teeth, and I think it's important for parents to know that even if they don't want to, it's one of those kind of non-negotiable things. Even if we don't want to do it, we're still going to do it every night, and just get them, make it fun and a fun process for them.
Good advice. Thank you so much. Appreciate it.
I appreciate it. Thank you for having me.
Yeah.